Hello friends, pancreatic cancer has remained one of the tough cancer to treat. And guess this year in 2026 ASCO, we have this new study which was presented called RASolute 302 study. There is a name of the drug called Daraxonrasib. So what is the problem this trial tried to address? So the pancreatic cancer has remained the tough cancer to treat. The median life expectancy still remain less than 1 year. And there are very limited options, mainly the chemotherapy for the pancreatic cancer. Therefore, this trial is very important. The drug, what they have tested in this trial called Daraxonrasib, which is oral KRAS inhibitor drug. It inhibits particularly KRAS G12. This is one of the commonest genetic mutation present in a pancreatic cancer. We used to believe that pancreatic cancer is non-targetable cancer, but this trial has proven us wrong. Now, let's deep dive into the trial. So it's a phase 3 trial, so it's already had its safety check done. It recruited 500 patients across 6 countries and 59 sites. So they recruited the patients who already had a previous treatment for advanced pancreatic cancer, or they have failed the treatment within a 6 months of after surgery. So in a nutshell, all these patients had previously treated. Now, the second thing is that why this trial matters in this setting. So after failing the first line treatment, the median life expectancy has remained 6 to 7 months, which is very dismal. And the average time of control, that is called a PFS, was remained roughly 3 to 4 months. Now, this mutation is common in more than 90% of the patients, so that's something really important, that it can capture the wider group of patients. Now, with any trial, there are certain group of patients they include. So for this trial, most of the patients had a 1 line of treatment. Like any trial, the patient has to have a certain fitness and certain inclusion criteria to recruit on the trial. The main thing is that they have to have a good performance status. They need to be independent for your daily routine to get into the trial and have an adequate organ function test, which may not present in some of our routine clinic patients. So 500 patients divided into 2 groups across 6 countries, and 91.8% of the patient had this RAS G12 mutation, and 70% patient had a liver cancer. That means it's really advanced tumor cases. Now, what I like about this trial is it's a phase 3 trial, so already gone through all the safety checks. It was different countries were involved. It was randomized. It was open label because we are comparing the tablet versus the infusion, and it's hard to control it. And on a pragmatic ground, they allowed clinician to choose the chemotherapy, which is very important in this setting, because what doctor would give is depend on the circumstances and what patient had previously treated. So that's something really good about the trial. So it was open label trial. That means the doctor and the patient both knew what they are getting. So sometimes it can introduce the bias, but otherwise it would be impossible to control the tablets and the infusion. Now, so Daraxonrasib tablet is a 1 tablet a day. The caveat is that it drug has a certain interaction with the other drugs. So always make sure that you check it out. And the chemotherapy were the standard of care, what we normally use. Now, this is the most interesting part, and everyone received these results with the great hope. Now, the patients who have a RAS G12 mutation, the median survival was 13.2 months, compared with the 6.6 months with the standard of care. That's a chemotherapy, which is 60% improvement. And if you look at the overall population, still it looks quite good, like 13.2 versus 6.7 months, which is surprising, because you would wonder, like, if you give a tablet which is targeted to the 1 genetic mutation, but it still works in other genetic mutation as well. So it's a pan-RAS drug, so that is very important as well. Now, in terms of the progression-free survival, how long this tablet controlled the cancer, in the trial it controlled for 7.3 months versus 3.5 months with the RAS G12 mutation. That is again a significant improvement, and for overall population still it's similar. Now, objective response rate, so how many times when you do the scan on the treatment shows the shrinkage. So it was 33%. So 1 in 3 patients would have a shrinkage compared with 1 in 10 with the chemotherapy. So that's quite good actually. Now, none of the treatment in oncology space is without side effect. So the side effects were rash, diarrhea, mouth ulcers, nausea, and vomiting. And this is pretty much expected for many of the KRAS inhibitors which are available in the market. Now, the grade 3 side effect, where we have to where a significant side effect, it's 43 versus 57, still less than chemotherapy. Now, serious treatment-related side effect were 10 versus 18% compared with the chemotherapy, still in the favor of experimental arm. Now, when there are so many side effects, we always concern. But at the end of the day, we look at how many patients actually discontinue because of the treatment. The treatment discontinuation rate was only 1.2% compared with the 11% with chemotherapy. So only small proportion of patients require discontinuation. However, 36% patients required some dose reduction to manage the side effect, while with the chemotherapy, 57% required dose reduction. What it tells you that even if you have a side effect, your doctor can look after you and adjust the dose or interrupt the dose to make sure that your quality of life, as mentioned. What I haven't put in the slide is that the patients, they also measure the quality of life, and the quality of life were maintained well on the trial arm compared with the chemotherapy arm. That is very important for the patients with the advanced cancer. Now, coming to the end, drug interactions are very important. This tablet has many drug interactions, so make sure that we check it out before you take it. And what is the key message? So the key message is that this trial has shifted our thinking, and that this pancreatic cancer can have a targeted therapy, and it also raised the bar of the expectation for the future trial as well. That's something very encouraging news. The second thing is that this drug, we still need to wait for this drug to become available in the clinic, and we don't really know what would be the price and what would be the outcome in the patients who are not trial eligible patients, so like who are not functionally very well, who have some organ dysfunction. So that's something time will tell us, but I'm very happy to have this trial presented, and hopefully it will available to all the pancreatic cancer patients. Take care.